It's the 16 of 10, 16. Um, I've been following those kind of the structure behavior in institutional from childcare institution where the child is moved from with commune and police to elderly institutional to handicap, all kinds of handicap, and to including mentally disturbed people, a psychiatrist patient, or also you could call a person with a lower IQ, right? All of these weak person. I even been in some kind of political confinement or ill treatment together with these people, right? I notice in this Denmark, and probably it's all over the world, and it also counts for political prisoners and even normal criminal prisoners. One of the things that stuck out was that the people who worked in those fields, that is prison guard, that is pedagogic, police officers and stuff like that. There's very few of them that actually knows about the background for the handicapped, or the handicapped may have for example, low IQ or emotional problems that make him later, in some degree, make something criminal, right? Not that there's nothing similar between all of these people. Each individual have their own, you know, their own way of dealing with their illness or their own kind of dealing with their life, right? One thing is just for sure, it seems to be that the level where they manage administration, both political, communes, police, stuff like that, there is a misunderstanding that all of these weak groups, no matter if children, elderly, handicapped, prisoners of all kinds, that one of the things stuck out from this is they have no rights. If they first are, getting a signature as having a handicap, being without parents, being without support from lawyers and stuff like that, it actually sometimes seems to attract staff and money that are doing something abusive, right? And that's not strange, because if you have an abusive character, right, and you don't want to go in jail, where would you look for some kind of access to weaker groups as imprisonment? I'm not talking about jails, I'm talking all kind of imprisonment where somebody control a life, a child, handicapped, elderly, or prisoner, right? Where would those people with the, you could say, personality, sadistic, controlling, psychopathic, abusive, where would all these kind of, you could say, successful people, if they're not caught up in some corner, where would all these people get a license to abuse? That would be in the kind of state control system environment, or you could say childcare institution, handicap institution, prisoner. So there is a higher risk that the surrounding staff in those places should be, you could say, checked or screened for having exactly and worsened personality in those in jail, okay, or in, so actually the claim system of being in an institution, as I see, I experience some of it, don't work. So if I go and call a doctor sadistic, manipulative, abusing diagnosis, abusing the money I actually earn and so on, I can risk that the claim system don't work. And that is a way that I think police sometimes forget, that also inside of their ranks is people who selected to have power for the wrong reason. You know, if some boys, when they grow up, they dream about having control about the uncontrolled situation. They dream about getting back at their often beaten survivment, something like that. They dream about making a so-called difference, you know, justified power. And actually, if they drag into police or pedagogue or military, they are what we call in my line of work the worst pigs. You know, the people who has chosen powerful position with access to others, would have no rights, no fighting back. There are those people that sometimes go a little too long free from being abusive. There are people inside the system that nobody really want to touch because that actually, you know, weaken the system. It doesn't weaken the system. If an elderly or handicapped says, or a child says, that this pedagogue, this policeman, this nurse is abusive, then you have to take it serious because it is serious. And this approach by that some elderly all have dementia and can't really, figure anything out. That's a lie. When you get elderly, many people don't remember anything. If you ask a 14 years old what they did at Sunday night, Christmas 2080, they would know. Okay, so you can't do these kind of weird tests, and we know all along many of the psychology tests or intelligence tests has been, I'm sorry, later found out to be completely false. We have a psychiatrist's history that more tells about a cruelty against some weaker groups. We also have a very divided thinking about psychiatric patients. Some of them are great artists, and some of them are almost like haunted animals, you know. So listen, maybe some respect from me to you, or from the staff to this patient, would actually do some miracle work, because the lack of respect right now in Europe especially, the lack of respect actually puts the society in less respect, right? So if the media and also the institutional, the elderly home, the institution for children, the way they talk about elderly, the way they show elderly in the media, the way they show weak families, abused families, or the way they show patients, right, is actually a way that will example for the population that they can overstep a line of respect, and they can overstep a kind of rights and laws. And do we want that in Europe? I don't know. But because if I sit here and say, if they want it that way, I could say, who do we really need? Do I need the normal, middle class, tax paid servant? Do I need them? Do I need to pay to people who actually a little abusive to other people? Do I need to pay their paycheck for them to abuse other people's unlock or handicap? Do I need those? I don't know. So actually, I do know. Actually, I like them. But listen, the respect from each person will actually, you could say, clear or screen that if somebody don't have the respect, maybe they have a personality that shouldn't be those staff, right? So respect, right, is the first thing. And if there's no respect, then the person is actually moving across a field into a gray zone, and maybe into a zone what we can call a personality of power abuse, right? You get that? And by a note here is the 161016. I still have a U-ring working here. I made some note about it. The local area is altogether not, you could say, cleared for those kind of things. Can't really set my finger on who and what, because it's too many actually. So it is not a secure area.